think art is a way in which we can express ourselves, and art has so much meaning from a community and cultural perspective, and to bring this in this kind of footprint where this building represents so much facts, data, publications, that it's really crossing that bridge between our fantasy or our dream and also reality of what we find.
The theme of that artworks is collective business, and it brings in everybody to have that conversation, not just Aboriginal people but also non-Aboriginal people that are involved in that business.
Here at the Hunter Medical Research Institute, we've been taking some time to reflect really deeply on what it means and is to be a research institute, and more importantly, part of our community. And as part of that reflection, we've really renewed our commitment to Aboriginal health and Aboriginal health research, not just as something that sits off to the side or something that we do when we think about it, but something that's really core to our purpose, to our ways of working, to our governance, to our decision making, and to the work that we do.
The way that we have our yarns and, troubleshooting through complex issues, but also that way of that collective way of doing business, Aboriginal business. And I guess for this we wanted to draw in the 19 streams of research and how we can make a connection with grassroots people, our country, our airways, fauna, flora, and what they do in how they contribute in informing us in the way that we do best practice.
This is the initial phase and initial steps to try and get research heading in the right direction to make sure we get good outcomes for our community. The translation meaning that we have equal opportunity in health, but more importantly, we have equal opportunity in life. And I think it's so exciting to have this. And to have such a vibrant piece of artwork on our building means that we can walk in here and smile every day. For me personally, it has such an impact in doing that. But also for other people walking in here who may not actually have that same connection, can actually look at that, start the conversation about why is that here, about what that means to them, but also hopefully get them smiling about the same process, so that no matter what kind of research we're doing, we're thinking about the local community, we're thinking about the national effect, but more importantly, we're thinking about what our global ambition is in being this space and research.
The lands on which HMRI, the building, is built, the traditional custodians of those lands, the Awabakal and the Worimi people, have been custodians of knowledge and of research and wisdom for tens of thousands of years. So if we can embed Aboriginal voices, Aboriginal leadership and Aboriginal ways of working into the way we think, own and operate our own research, then we can ensure that the benefits of our efforts are here for generations to come.